Great. Well, since it's 2 minutes past 7, I'd like to welcome everyone tonight to the 5th Annual AMA DEA webinar, Leadership and Action from Australian Doctors. This has been something that was instigated 5 years ago when DEA and the AMA formed an MOU for action on climate change, sustainability and healthcare sustainability. So it's been fabulous to be able to do this annually, and it seems to have grown bigger every year. And we've got a great representation from many of our colleges this evening and many esteemed speakers. So thanks for joining us. For those who don't know you, my name's Eugenie Kayak. I'm an anaesthetist in Melbourne. I'm the convener of DEA's Sustainable Healthcare SIG and also Enterprise Professor in Sustainable Healthcare at the Melbourne Medical School. I'd like to begin by acknowledging the traditional owners of the land that we're on. For me, it's the Wurundjeri people of the Kulin Nation, and pay my respect to their elders past and present. Also acknowledge and remind ourselves of their true custodianship of land, country for millennia, particularly as we reflect on climate change, environmental degradation and sustainability tonight. So thank you all for joining us. This webinar is going to be recorded, and it's being recorded presently, and the recordings from the past year's webinars are on the DEA website. We have a very packed agenda, and at the moment it's likely to go to 8:45 Eastern Time. We will try very hard to stick to time. Thank you all our panelists and speakers, and we'll see how we go for questions at the end. I know that would be ideal, but encourage you to put questions in the Q&A that speakers may be able to answer as we continue on. So thank you very much. And without further ado, we're going to have first up a recording from DEA's chair, who's Laureate Professor Nick Talley. So over to that recording. And Kylie or Kate, I'll just say that I can't actually hear it.
No doubt we have a problem, a really serious problem. And the problem is worldwide. But it doesn't mean there are not those who are trying to dismiss the problem as being irrelevant or even irrational. And that includes the US president, who's called climate change a hoax and who has really focused on drill, baby, drill to improve the US economy. The trouble is, the real truth is global heating is accelerating. There's absolutely no doubt about it. The science is rock solid. The current warming rate per decade is around now about 0.4 degrees Celsius. That means if we continue on the current trajectory, which seems likely in some people's views, we are going to have a 3 degrees Celsius rise above pre-industrial levels in 3 decades' time. And frankly, every single amount we reduce this, the better the outcome will be for all of us. But the trouble is, we're not taking sufficient action right across the world, even though action is being taken. It's also a health emergency. And for that reason, we as doctors, we as health professionals really need to get involved. We may not have been involved enough up to now, many of us, but we absolutely need to be involved. This has been well emphasised in the first National Climate Risk Assessment released very recently. The findings here are credible, they're sobering, and they're frankly conservative. The point is, we're going to see health impacts across the board, across the nation. For example, heat-related mortality is predicted to increase dramatically under a 3 degrees Celsius scenario, which seems now, unfortunately, more and more likely. And clearly, this is going to affect not just the elderly and the infirm and those who are predisposed with chronic disease, but also healthy young Australians working outside or playing sport outside. And arguably, it's already happening. We're seeing tennis players, I'm a very keen tennis player, we're seeing tennis players collapsing from the heat in 2025. Unprecedented numbers of people fall into this already. Some people have said the tennis authorities really are looking for a player to die. That's pretty dramatic. But the point is, we're seeing heat effects now, and they're going to get a lot worse for all of us. And the economic impacts are going to be enormous the way we're going. For example, we're going to have areas of Australia where they'll be essentially uninsurable for floods and fires. And the insurance industry knows this well. They've worked it out already. And you can't insure against, you can only insure against unlikely events. If the events become likely, insurance becomes not possible. What's the Australian government doing? Well, on one hand, they're talking about reducing emissions locally, and on the other hand, they're approving, for example, the Northwest Shelf extension, which will lead to enormous increases globally of greenhouse gas emissions. And frankly, we're losing out. We're losing out in terms of health, we're losing out in terms of the environment, and we're losing out economically, arguably, because really the amount we reap back from these government approvals is arguably really inadequate compared to countries like Norway, which do this much more sensibly. And unfortunately, we still have voices in Australia arguing we shouldn't be worried, despite the scientists, despite the facts, despite the evidence. This is utterly irresponsible and utterly incorrect. Unbelievable in 2025. The truth, global heating's accelerating. It is a health emergency and we're all going to be involved. And Australians and people around the world are going to face crisis after crisis after crisis, and we won't be able to respond anywhere near as effectively in the future as we can now, because we're going to be overwhelmed, as the government report has clearly said. I think we need to frame this very clearly. This is a battle between good and evil. Quite frankly, quite simply, good and evil. And we need to recognize that's the case. It's very much like the tobacco industry. Essentially, the tobacco industry spent decades, 50 years, according to a judge from the United States, 50 years engaging and executing in defrauding the public in terms of the health impacts of smoking. Dreadful, evil, inappropriate, unbelievable, true. And arguably, the fossil fuel companies have been and still are doing the same. They've been lying to us despite knowing the facts. And this is, again, basically intolerable, evil, unbelievable, true, it appears. Doctors, however, can and have made a real difference. Look what we did with smoking, for example, and plain packaging. And doctors have led various movements to do something about tobacco. Here's Dr. Bronwyn King, who really worked hard in the tobacco-free portfolios world to ensure that basically tobacco companies would not be funded by companies that were legitimately investing. And this has been very effective around the world. And indeed, the Doctors for the Environment Australia has a guide for shareholder activism to, in fact, encourage similar actions for fossil fuel companies because really ethical investing should not include fossil fuel companies, period. There are legal actions doctors can take too. The Doctors for the Environment Australia, for example, took Nopsema and Woodside to court, arguing, in fact, that there really needed to be a judicial review of Nopsema's approval of the environmental protection plan for Woodside Scarborough gas project. Yes, DEA lost, but DEA's actions have led to positive precedents that will be able to be used by others if they seek to limit the environmental impact of fossil fuel companies in Australia. And more action will be, I'm sure, occurring because of this. And this is a good thing, because honestly, we need to do something about it, and leading ethically here is appropriate. Advocacy is hard, we know that. It's slow. Look at the tobacco industry advocacy efforts over many decades, but the wins can be huge. Look at the losses by the tobacco companies over time. Enormous in court, enormous in the public opinion arena as well, enormous in terms of reducing smoking. So what can we do, and what should we do now? I would argue we need to take action as trusted voices in the community. And of course, preventing more climate change, reducing this greenhouse gas emissions as much as possible, looking at ways we can better mitigate. This is all important for doctors to become involved with. We can educate the public. We can educate our patients. We can take advocacy actions, many of them together, and be very effective. We can change our own practices. We can change the practices in public hospitals and in private hospitals around the country that will make a huge difference. And how can you pitch in? Well, let me say this: working together is much more effectively than working individually. Please join us, join the DEA. If you're a doctor or a medical student, you can join directly. If you're not, if you're interested, you can become a friend of DEA and join us to work with us to make a difference. And of course, the AMA as well is really taking excellent action and approaches, and joining them and working with them is also something I'd strongly encourage. Thank you very much.
Excellent. Well, there we go. Nick Talley, as always, DEA's chair, always powerful in his delivery and message, and a great way to set us up for this webinar tonight. Now I'd like to hand over to Associate Professor Julien Rait, who's the Vice President of the AMA, to say a few words. And for those who weren't there at the beginning, DEA and AMA have had an MOU and co-run this webinar for over 5 years now. Thank you, Julien.
And thank you, Eugenie, and thank you too to Nick for those warm words of introduction. I'd also like to welcome everyone that's jumped online tonight and considers this an important issue. I too, of course, would like to acknowledge traditional owners of the lands upon which we're meeting, which, like Eugenie, is the Wurundjeri people of the Kulin Nation. And I think it's particularly relevant tonight that we do recognise the Aboriginal and Torres Strait Islander communities in Australia and their traditional ecological knowledge that's been held for over 65,000 years. Equally, the AMA is very proud of our partnership with DEA. This webinar is in its 5th year, showcasing the leadership and action demonstrated by Australian doctors. As a doctor, but also as a father and a grandfather, I do worry about Australia, and especially if we as a country are really doing enough. I worry about political leaders who make decisions about the now and not the future. I worry if parts of our great planet will be uninhabitable in the future. And I worry that future generations will look back on our generation with disdain for not embracing the cultural responsibilities for caring for country, because we didn't really listen and remember. Political debates surrounding climate change are all around us, as Nick's explained. US President Donald Trump, during his address at last month's UN summit, did indeed call the concept of a carbon footprint a hoax. I quote a line from his speech: "This climate change, it's the greatest con job ever perpetrated on the world, in my opinion," Trump said. And locally, the National Party is little better. It voted to drop net zero targets in Australia. I understand the intersection of energy costs and concerns about global energy prices and further public concerns about how Australia's policy might play out. But Australia is already seeing impacts of climate change, including fires, heat waves, coastal erosion, etc. So delaying transition is viewed by many as just increasing future costs. Also, as Nick mentioned, our government's own National Climate Risk Assessment, released in September, painted a challenging and confronting view of the future for Australia under global heating. What's clear from the report is that every aspect of Australian life is being challenged and is being disrupted. Nothing will be spared, with an overwhelming array of impacts that cut across each other. A 2-degree global temperature rise will increase annual heat wave related deaths by 190% in Sydney and 126% in Melbourne compared with today's levels. And we've already seen the global temperature breach 1.5 degrees just last year. Globally, it is increasingly clear how closely the problems of climate change and health are intertwined. Heat-related deaths are accounting now for 3% of mortalities in 26 countries. Climate change brings other health hazards too. By changing how much moisture is in the atmosphere, higher temperatures can alter precipitation patterns, making both extreme drought and downpours more common. Hotter and increasingly dangerous weather patterns, such as Hurricane Melissa just last week, are becoming more frequent and more intense. And we all remember the bushfires, unfortunately, of 2019-20, and many will also remember the atrocious air quality that followed. Particles of 2.5 microns or smaller, or so-called PM2.5, we all know can pass through the lungs and into the bloodstream, causing or worsening respiratory and cardiovascular conditions and increasing the risks of certain cancers. In fact, we've seen deaths caused by exposure to PM2.5 as a result of those bushfires rise by over a third in the last 10 years. Also, hot and wet conditions allow mosquitoes to thrive. Cases of dengue fever increased by 50%. Zika virus and leishmaniasis cases have also dramatically increased. And many of you will be aware that in North Queensland, due to intense rainfall, the soil bacterium melioidosis has infected and killed over 30 people and resulted in severe illness in over 200 people. But back to Trump and back to the Nationals here. How can climate change really be thought to be a hoax? Some of you may remember the AMA held a roundtable called Rising Temperatures, Rising Risks in February of this year. We heard some pretty harrowing stuff at that roundtable, including the impact not just on physical health, but on mental health too. When temperatures rise, there's an increasing number of young people who will end up in hospital emergency rooms as a result. We also heard about the impacts of rising temperatures on First Nations peoples, together with the need to involve First Nations peoples in developing solutions. Climate change is also driving an increase in communicable and other diseases, as already mentioned. So the continued burning of fossil fuels not only heats the planet, but also produces air pollution, causing millions of deaths a year. Recently, the AMA in the Northern Territory expressed concern of Darwin and Palmerston residents following reporting that the Darwin LNG plant had been leaking methane, a very potent greenhouse gas, of course, for nearly 2 decades. The failure of both ConocoPhillips and Santos to disclose the leak in a timely manner constitutes a profound breach of public trust and has potentially exposed the community to significant health risks. Moreover, across the harbour from Santos, not to be outdone, the oil and gas giant Inpex has admitted to drastically underreporting its toxic emissions. So where we have these plants 3 kilometres away from residential suburbs and 10 kilometres away from Darwin City, causing considerable pollution and harm potentially to the local community. Unfortunately, Australia does not have a Clean Air Act, which would be vital in protecting human health in these circumstances.
We're at time, Julien.
So key leaders, governments and corporations are backsliding on climate commitments and putting people increasingly in harm's way. Indeed, I'm reminded of the Indigenous phrase Waringa Lee that translates to listen and remember. Consequently, I call on all decision makers to be courageous, make decisions that are right by community and not just industry. Thank you.
Wonderful. Thank you, Julien, and a big thank you again for the AMA for showing leadership in this area. And for those who may not know, I also suggest you read the AMA's One Health position statement because it has some excellent statements when it comes to fossil fuel exploration. Next, we have a recorded presentation from Professor Michael Kidd, who's the Chief Medical Officer. I'm not sure if he's going to say it in his recording, but when I joined the DEA Board well over a decade ago, Michael was then the chair of DEA. And in fact, he was also the chair of the Climate and Health Alliance's inception meeting. So he has a long history of action and leadership when it comes to climate change as a doctor. Over to the recording. Thank you.
Hello, and thank you to the Australian Medical Association and to Doctors for the Environment Australia for inviting me to speak this evening. I acknowledge the traditional owners of the land from which I'm speaking, the Ngunnawal and the Ngambri peoples, and I pay my respects to their elders, past, present, and emerging, and I extend that respect to all other First Nations people who are joining us tonight. I also acknowledge the leadership of First Nations peoples who have guided and continue to guide us in understanding the intimate connections between the health of the land, culture, and people. As Australia's Chief Medical Officer, a current and long-standing AMA member, and a past chair of Doctors for the Environment, I acknowledge the role played by the Australian medical profession in galvanising action on climate change and health in our country. We are gathered at a pivotal moment, not just for our health system, but for the health of our planet. Climate change is no longer a distant environmental issue. It's a present and growing health emergency. But this is also a moment of opportunity. As health professionals, we're not just responders to climate impacts. We're leaders in our communities, shaping the future. The choices we make now will determine whether our health systems are prepared, sustainable, and equitable in the face of a changing climate. Australia's first National Climate Risk Assessment has made it clear that climate change is already affecting our health and well-being and the health systems that support us. The National Climate Risk Assessment identified that by 2050, our health and social support systems will be among the systems most at risk. In the face of these challenges, we need to ask, what does a future-ready health system look like? The National Health and Climate Strategy, launched in 2023, is our first national whole-of-government plan to address both the health impacts of climate change and the contributions of the health system to climate change. The strategy is structured around 4 core objectives. Firstly, health system resilience, which is about building capacity to protect the health and well-being of our community from climate impacts. Second, health system decarbonisation, about creating a sustainable, high-quality, net zero health system. Thirdly, international collaboration, recognising that climate change is, of course, a global issue, and so global issues and solutions are required. And finally, health in all policies, about embedding health and climate considerations across government decision-making. Importantly, the strategy also commits to elevating the leadership, wisdom, and knowledge of First Nations peoples in responding to climate-related health challenges. We're now almost 2 years into the 5-year program of work laid out in the strategy, and thanks to the efforts of many of you taking part in this meeting, we're making real progress. Some key highlights include the work of the interim Australian Centre for Disease Control in publishing a report providing baseline greenhouse gas emission estimates for the Australian health system. This will inform prioritisation of our decarbonisation actions and also aid in tracking the progress in these efforts. The Australian Government is delivering the Pacific Climate and Health Resilience Package, which is about strengthening regional health systems. And we've also joined a global initiative to decarbonise healthcare supply chains. The NHMRC has announced $11 million in research funding on the impacts of climate change on the health and well-being of Australians. and a further $6 million from the Medical Research Future Fund is allocated for research addressing the impacts of climate change on the mental health and well-being of our population. The Australian Commission on Safety and Quality in Healthcare, with support from the interim CDC, has launched a new module to embed climate resilience and environmental sustainability into health service governance and clinical practice, and I expect Carolyn will be speaking about this. These are not abstract policy achievements. They're concrete steps towards a health system that is better prepared, more sustainable, and more equitable. And there's still more to come. This is not just about preparing for future risks. It's about delivering better health outcomes now. Cleaner air, a healthier environment, and more sustainable healthcare models will all bring immediate benefits to our patients, our communities, and our health system as a whole. The strategy gives us the roadmap. Now we must walk it together. As health professionals, we're not just implementers of policy and clinicians. We're leaders, advocates, and trusted messengers in our communities. Across Australia, clinicians are working with educators, managers, and researchers on driving change. Many of you in this room have helped to shape the strategy, contributed to its implementation, and are modelling what climate leadership looks like in practice. In closing, we're living through a decisive decade for climate and for health. The National Health and Climate Strategy has, as I mentioned, given us a clear roadmap, and implementation is underway. And the leadership of health professionals, many of you taking part today, is driving real change. But the scale of the challenge demands more from us. It demands that we embed climate resilience and environmental sustainability into every aspect of health system planning, delivery, and governance. It demands that we continue to centre equity, that we amplify First Nations leadership, and that we collaborate across sectors and across borders. The Australian Government will continue to draw on your expertise, your achievements, and your momentum as we move forward together. The health of future generations depends on the decisions that we make today, and our health system, with its reach, its credibility, and its compassion, is uniquely placed to lead. Thank you all.
Okay, so as always, very wise words from Professor Michael Kidd, and I must say it's encouraging that someone with his background is our Chief Medical Officer presently. So without further ado, I'd like to now pass over to our final keynote speaker for this evening, Professor Carolyn Hullick, who is the Chief Medical Officer for the Australian Commission of Safety and Quality in Healthcare. Thank you, Carolyn.
Thanks, Eugenie. Let's see how I go with this. Share, there we go. And this. So I'm going to follow on from Michael's talk. It's really good that we were following each other. The Commission's works very closely with the interim CDC, and we're very grateful for their leadership and support. I'm going to go through some of the work that the Commission's working on at the moment regarding sustainability. But I think the most important thing from my perspective is this first slide. I think as doctors, we have a big role to play in the health system, and we really need to understand that safety and quality is environmental sustainability and climate change. And we really need to consider the way we practice medicine and the decisions that we make every single day as clinicians.
I'm sorry to interrupt you, Carolyn, but your slides keep flashing up and then down. Maybe you've got the cursor on the share button or something.
I don't think so. Is that better?
Happening for other people? Yeah, it seems to be still and out. Just kept going whoop and then down.
Yeah, it was.
So sorry to interrupt your flight.
No, that's all right. Is it I'll keep away from my slot. Is that okay now?
No, it's doing something funny.
No. Hey,
you want to share the slides? Yeah. You've got my slides, I think, Kate, haven't you?
Yeah, I do.
I might just get you to share them. Sorry, I'll stop sharing.
No, that is fine. It's always the tech. If you stop sharing, I'll start.
Feel free to keep talking while Kate does that.
Yes. So I think from my perspective, we really need to consider as doctors our role and how we practice medicine. So the first thing is the when we think about sustainability, I think about it in three things. One is around prevention. The second one is around minimising harmful and wasteful care, and the third one is around minimising emissions. And if we think through those three things, we've actually got differences that we can all make every day in medicine. So I think for me, so prevention is about strengthening primary care, strengthening general practice, doing whatever we can in the community, because when we, there we go, I'm up to the, maybe go to the third slide, Kate.
Sure.
So next slide. So yeah, so prevention strategies, I think when we, oh no, the slide before, sorry. When we strengthen primary care and we reduce admissions to hospital, we actually reduce our impact on the environment. The second one, I think as doctors, we have to get much better at shared decision making and how we have better conversations with patients around what matters to them and bring that together with evidence-based practice to ensure that we're providing the care that the person wants, which is also good for the environment. And then the third one is around integrated systems and reducing duplication and inefficient use of our time. One of the things I've done recently is chair the legislation for the share by default for my health record. So pathology and imaging will go up onto my health record so that clinicians, we can see what tests patients have had and make sure that we're not duplicating tests if people have already had them. Next slide, thanks, Kate. So we've worked closely with many of you online, and I thank you all for your leadership with the interim CDC, the Commission, and the Council for the Presidents of the Medical Colleges, and also for the Australian Indigenous Doctors Association, with us all agreeing to come together to work on climate change, which seems like a simple thing, but I think for many of the medical colleges, there are differing sizes, and so some of the bigger colleges can have more sophisticated mechanisms and education and training for their fellows and for their members, and for the smaller colleges, they really needed support. So I think for me, that was one of the really important things for this work, is that we all agreed to work together and every single college signed up. So that's great. Next slide. So as part of that, we agreed to form a health college working group on climate change and to develop a framework for collaborative action. And I'm hoping Sonia's online. She was really instrumental in developing this work, but we also brought in the nurses and allied health to really think about what are the practical things that colleges could actually do to support climate change. We've completed the first three actions, which is position statement and partnerships, education training, and research and quality improvement. And many of you, as presidents of colleges, or your colleges will be receiving that document shortly. And our aim over the next few months is to get it signed off by all the same group who signed up to the joint statement, as well as allied health and nursing. Next slide, thanks. The next piece of work that Michael touched on is the healthcare sustainability and resilience module. So the Commission's in the process of updating our national standards, and this sustainability module will be built into the third edition, and the first draft of that will be out for next year. Next slide. Now I've got 30 seconds. These are the things, but basically it's putting a governance structure for health services around climate change and resilience that will help us as clinicians to ensure that we have the right resources to do what we need to do. Next slide, thanks. The Commission does an atlas of healthcare variation. It goes down to the SA3 level, which is 2 or 3 postcodes. And we've looked at spirometry and pharmacotherapy as the most recent atlas. Spirometry is down by 30%, but triple therapy puffers are up by 130%. So patients aren't getting the right diagnosis and not knowing they've necessarily got COPD. Triple therapy puts them at risk of increasing infective exacerbations and pneumonia. So it's a good example of the things that we can actually do if we make better diagnosis for COPD and we treat them better, then it's better for the planet too. Next slide. And that's the variation across the country with the things I've just mentioned. Next slide. Thank you. That's it. Thanks very much.
Wonderful. Thank you so much, Carolyn, and thank you for being very prompt, in fact, making up some time for us there. And congratulations, really, to the Commission. It's quite extraordinary what you've achieved over the last year or two in bringing all the colleges together and the Health College Working Group on climate change and the joint statement. It's amazing how far things have come along. So thank you. All right, so now we're moving on to our 5-minute allocated time slots, and we're really asking all the speakers to keep to time. Just think of maybe a bit like speed dating. I'm not quite sure how that works, but we're going to be pretty strict with our times. And first of all, we have Dr. Kimberly Humphrey, who is on the DEA Board, and she represents DEA on the WHO ATACH steering group. Thanks, Kimberly.
Thanks so much, Eugenie, and I'm going to stick to time. Watch me do this. All right, I'm going to share my slides now. Hopefully that looks appropriate and like it should. Fantastic. Okay, as Eugenie said, I am going to talk about who ATACH, which DEA is involved with, and a little bit about COP30 as well and why it's relevant to us really as clinicians and people who work in health in Australia as well. So, this would take a very long time to explain properly, but I'll do my very best in the limited time we have. So the World Health Organization has a network called the Alliance for Transformative Action on Climate and Health.
Kimberly, your screen's gone blank. It's a blank slide at the moment. I'm not.
That's a bit odd. Hang on, I can see it on mine. How's that?
That's better. Yep.
Okay, I'll leave it like that. Alliance for Transformative Action on Climate and Health. So this is a network that was put together by the World Health Organization after COP26 to really realise the ambitions of that COP, which was centred around health as well. So this is an alliance of many different actors, so governments, non-profits, academia, health professional associations, which I'll come to in a moment, and many others as well. 95 countries, over 80 partners who've come together to really deliver on these commitments. Key objectives of ATACH really sit across a number of areas. So the kind of things that we talk about, sustainable healthcare, climate resilient systems, those are the two commitments from COP26. So ATACH is really essentially trying to deliver on those. The exciting thing for us is in DEA, we were about a year ago named as the steering group representative for all health professional associations worldwide. So that's more than 60 million health professionals that are represented through that network. We sit on the steering group, and I've got the membership just there on the right-hand side. And the reason I put that up is because it really demonstrates who we're in the room with. So we're there with leaders of the World Health Organization regions, we're there with the World Bank, we're there with the World Health Organization, of course, but many other really significant partners too that we are around a table with, talking about how we can deliver on these commitments. And specifically, our remit is for health professional associations, which is really exciting because we are the voice, the frontline voice in this area, and we are representing all health professional associations. So it's a really important and impactful job. Very briefly, I'm going to touch on COP30 as well, just while we're in the international sphere. So COP30, I think many of us who are on this call may not completely understand what we might be doing as Doctors for the Environment in this space. So COP started as the negotiation, the climate negotiations, and it was really focused on the negotiations. Now it's really about civil society as much as it is about the negotiations. So the civil society part of COP is actually bigger than the negotiation side. So really big, powerful group of people who go. And why does this matter for us? So we know all of these things. Climate change is poised to undermine decades of progress. All countries are experiencing these impacts, health systems under strain. But the really key thing is this is the only time that a lot of countries can come together on these world stages with people who are making the decisions. So a lot of our low and middle income countries and those who are representing the global south, this is the only time that they're in the room with a lot of these people, or we're all able to come together in a way to discuss these things. We really try, and I say we as the global climate and health community who attends, push the health agenda very aggressively because we are very good at doing this in our silo and talking about health in our silo. And we see this domestically, but it's true internationally as well. But really getting that message out as a lever for climate action, for cross-sectoral action, the argument is so, so strong. And really using that in that civil society space to advocate for health as a mechanism to achieve what we need to achieve. We know that it's a really compelling argument, saves huge amounts of money, huge impacts on our communities worldwide as well. Not a lot of people outside of the health sphere necessarily understand this. So when we can make these arguments and when we talk about the real impact on people, it resonates, and it actually does have ripple effects across the globe as well. There is much to be done with health in the negotiations as well. So there is a degree of time spent talking to negotiators and working in the policy space about things like funding. So health and adaptation is massively underfunded. This year is the year that nationally determined contributions are due. So all the countries have to come forward and say what they're doing. And if we don't include health in those, or they don't respect health, then it has significant impacts on mortality and morbidity for communities as well.
30 seconds.
Thank you. So this is just to illustrate the kind of really vibrant civil society things that happen at COP. So it's certainly not people sitting in a room negotiating. It's a lot of collaboration, networking, really tackling this as a global problem it is, and really building up our climate health voice across the globe. This is the World Health Organization Pavilion, which is quite cool because that is supposed to represent lungs. So this is the kind of thing that there is the opportunity to be on panels for as well. So this is what we're doing at COP. I'll just flash that up very briefly. The Health Pavilion events are live streamed, but the time zones are absolutely horrific, like 4 o'clock in the morning, 7 o'clock in the morning, but we are involved in 7 events, which is really exciting. And there will be a webinar on the 13th of November as well, where I will be at COP and we'll bring in some colleagues from international areas and we'll do a little bit of a webinar as well, just to talk about the relevance of COP and what we're doing on the ground there as well. Very last thing that I'll say very quickly is this is not for individuals, but for organisations and particularly our colleges. Join ATACH, be part of the health professional voice. It really is incredibly important that we do this work. It costs nothing, obligations are minimal as well, and we need an Australian health voice in this space as well. We have a lot of representation from overseas, not a lot from Australia, and I really think that this is something that we can change and really have that impact globally as we should. And that's it. Thank you.
Thank you. Thank you very much, Kimberly. And I concur. Please do engage with DEA when it comes to ATACH, and also consider joining your own health professional organisation up to make us a more powerful voice on that steering group. And thank you, Kimberly, for representing us at COP30. Next, we have Dr. Grant Silbert, who's the co-convenor of DEA's Medical Education Special Interest Group. Thank you, Grant.
Thanks, Eugenie. Yeah, as Eugenie said, me and Sonia Chanslani are the co-chairs of the Medical Education SIG in Doctors for the Environment. And in the evolving and complex national landscape, DEA has emerged as a leading voice in advocacy and education, driving curriculum reform, resource development, and system-wide engagement across the medical education continuum. Kylie, I'm not sure if you're able to pop up the slide that I sent. One of the projects that we've been involved over the last year is the AMC Standards Update, which many of you will have made submissions to on behalf of your colleges. We've been working in close partnership with medical students, universities, specialty colleges, the AMA, government bodies, and DEA has played a really central role in accelerating the integration of planetary health across the medical educational landscape. And throughout submissions to the AMC, DEA has advocated for stronger inclusion of environmental sustainability and climate health principles in the education and accreditation frameworks for medical students, junior doctors, and medical specialists, helping to ensure that Australia's medical workforce is climate ready. One of the projects I've been heavily involved with over the years is the Planetary Health Report Card, which is an international organisation that serves as a powerful student-led evaluation and advocacy tool, promoting continuous improvement in climate and health education. The PHRC was launched in Australia and New Zealand in 2024 under the shared leadership of DEA and the Australian Medical Students Association. This year, the focus is establishing a formal collaboration between the PHRC and DEA to strengthen national coordination and support for Australian medical schools. The collaboration will help to ensure that institutions incorporate DEA's medical education resources into medical curricula and ensure that planetary health and sustainability become core components of medical training right from the student level. Another project that we've been working on quite heavily is the specialty-based curriculum resource project. And this follows on from a very successful project that was, you can see the picture there, mapping climate change to the health in medical education curricula. And we're extending that in this iteration to become specialty focused. So developing specialty specific literature reviews to inform educational content, such as CPT modules, workshops and courses. Several reviews are in their final stages, with RANZCOG already collaborating to use the obstetrics and gynecology materials as the foundation for new clinician CPD resources and patient education materials. A manuscript outlining the project's methodology and outcomes is in progress, and we'll reach out to those interested colleges about opportunities to get involved. Finally, another new development in the medical education space is the Grand Rounds Guide that has been in development over the past few years, but has recently been finalised and published. The new Grand Rounds Guide has been published and is available on the medical education website alongside a suite of new teaching resources. The Grand Rounds Guide is designed to help clinicians and educators deliver sustainability-themed grand rounds within hospital and health services. It provides step-by-step instructions, including suggested topics, evidence summaries, and case examples to make it much easier to normalise the discussions that we have so often, but may be new to the broader healthcare world, discussions about climate and environmental sustainability, and incorporating that into medical education. We have many educational resources that are freely available on the DEA website, so I encourage you all here to go check it out. We've recently updated the website, and you can find there podcasts, webinars, fact sheets, a sustainable conference guide, and the Green College Guidelines. So together, these initiatives advance DEA's missions to build a climate-ready health workforce, equipping clinicians and students with the knowledges, skills, and leadership capacity needed to deliver sustainable, high-quality healthcare that protects both people and planet.
Wonderful. Thank you, Grant. And thank you so much for all your work and leadership in this area, and as well for Dr. Sonia Chantalanti leading the education SIG. It really is quite phenomenal what you and others have managed to do over the last few years, and also Kari Lee for leading the new Grand Round package. Okay, so now we're on to our colleges and their representatives. So I'm not going to introduce each of you individually of your position. I'll leave that to you to do a quick, brief introduction and hand over to Dr. Ben Dunn from RACS. Great, Ben, we can see your slides.
Great, yeah, perfect. Just checking there up. Good evening. My name is Ben Dunn. I'm a thoracic surgeon, and I'm the chair of the College of Surgeons Environmental Sustainability in Surgical Practice Working Party. I'm very proud to be here this evening representing the college and our president, Owen Ung, who is unfortunately unable to attend. RACS is a binational college, and as such, RACS acknowledges the Aboriginal and Torres Strait Islander people as the traditional owners of the land that we're all on today, and extends our respects to elders past, present, and emerging. RACS respects Ngāti Māori as the Tangata Whenua of Aotearoa, and is committed to upholding the principles of Te Tiriti of Waitangi, fostering the college's relationship with Māori, supporting Māori fellows and trainees, and striving to improve the health of Māori. The DEA AMA Green College Guidelines provide a roadmap for colleges to integrate sustainability into their governance structures, operations, education, and research, and was designed to help colleges become leaders in sustainability. RACS is really proud that we were the first medical college to sign up to these guidelines, and we're committed to continuing to adopt them in practice. And I'll briefly highlight how RACS has been performing against each of the categories laid out in the Green College Guidelines. Firstly, RACS has embedded sustainability into our organizational strategy and governance. One of 4 priority areas in our current strategy, which is expiring soon, is leading a sustainable future for surgery, with a focus on promoting environmental sustainability in surgical practice and contributing to addressing climate change. We have established governance around sustainability with our working party, which has been in place since 2019 and growing in size and capability. We've also recently got some subgroups formed with a focus on education, research and policy, as well as industry engagement and advocacy. Internally, we've been successfully advocating for divestment from fossil fuel related investments, with only one final investment portfolio remaining up for discussion in our financial portfolio, which has been great. Our advocacy work in the last 12 months has been largely through signing on to the joint statement on climate and health led by the ACSQHC and the National Health, Sustainability and Climate Unit. We're a member of the resultant Health College Working Group on Climate Change that was formed as a result of that statement, and are very keen to see that work properly funded and supported by government moving forward. We've been a long-standing member of the RACP-led Multi-College Advisory Committee on Climate and Health, and our additional work on advocacy to date in the last 12 or 18 months has been through submissions of note being on the National Health and Climate Strategy, the Health Technology Assessment Methods Review Process, and most recently the AMC Standards for Specialist Training. RACS has publicly supported the DEA AMA healthcare emission reduction targets, calling for an 80% reduction in healthcare emissions by 2030 and a net zero target of 2040. And we've signed the World Organization of Family Doctors letter calling for a ban on all new fossil fuel projects internationally. On the education front, RACS was a key contributor of the team that developed the International Green Surgery Report led by the UK Health Alliance. We're now working on making this comprehensive review more accessible as we're preparing for the upcoming AMC accreditation and education changes. Our education subgroup is now formed and led by Professor Margaret Schnitzler, and we've almost completed the development of 3 specific CPD modules on sustainability in surgery, focusing on how climate change will impact surgical diseases and the delivery of surgical care, the principles of sustainable surgical practice, so surgeons can learn how to make these changes themselves, and a 3rd module on how high-value care is low-carbon care, developing sustainable models of surgical care and surgical practice. These will be supplemented by podcasts and webinars to follow throughout the year to continue to get the message out through our various mediums and messages. RACS also recognises the evidence gap that we need to address in order to better map the path to net zero surgery. Our research subgroup of the Working Party is led by Dr. Russell Hodgson, and our role is there to develop networks and surgeons that can deliver research on environmentally sustainable surgery. We've been actively developing this evidence ourselves. We're collaborating with important stakeholder organizations to develop consistent guidelines and policies and position papers across the board, with examples on position papers such as reusable sterile linen, and currently underway position papers on reusable theatre hats and the role of multidisciplinary meetings in reducing low-value surgery. We support other surgeons and health professionals in undertaking research in this area through scholarships, dedicated presentation opportunities at our college annual scientific meeting, a collaborative relationship with our journal, ANZ Journal of Surgery, and this year we're establishing the inaugural David Fletcher Prize awarded to the best presentation at the ASC on the topic of sustainability in surgery in honour of Professor David Fletcher, who founded our Working Party and has been a leader in this space for some time and a keen DEA member. Finally, RACS has been working on a number of initiatives to reduce the operational carbon footprint, encouraging virtual meetings and avoiding air travel where at all possible. RACS owns some buildings, but also conducting an energy audit of all the offices statewide to identify areas where energy use can be optimized. We've also been looking at ways to improve waste management in the college and reduce water use as well. Thanks very much for the opportunity to present today and demonstrate how RACS has been working to meet the commitments outlined in the DEA AMA Green College Guidelines. Thank you very much.
Great, thank you. Thank you, Ben, and thank you for highlighting those guidelines and for all the work that you and RACS have done. Very impressive. Next, we have Dr. Stephen Gurley, who is from ASIM. Or maybe we don't.
Sorry, I was on
Oh,
mute.
there you are. Yes. Yeah.
The good old mute button. You'd think after COVID I would have thought. Thanks very much, the DA and the AMA, for the opportunity to speak tonight. Firstly, to say this is a really good initiative and we really applaud the good work that you're all doing and very much support it. I'm the current president of ASIM and I'm also the clinical director in Alice Springs. At ASIM, we take climate and sustainability very seriously. And I'm proud to say that we were the first medical college to formally introduce a climate change emergency in our ASM in Hobart in 2019. Shortly after that, our board decided to move towards ethical investing, and we have been doing that since 2020. I think we can all acknowledge the science of climate change is undeniable, and I'm going to take that as read. I'm just going to give you a brief update of what we're doing in ASIM in the area. In our board meeting of July this year, we have confirmed that sustainability will become the 4th pillar of the ASIM Foundation. This joins Indigenous health, global emergency care, and research as the other 3 pillars. So it's a really significant move on for us in this particular space. We have a very active climate sustainability network that's superbly chaired by Simon Judkins and Brian O'Connell, probably well known to all of you. We're currently partnering with our friends and colleagues at ARCM, which is the UK equivalent of ASIM, for a Green ED initiative. This forms a framework for us to move towards clean energy, better design of new EDs to reduce heating and cooling costs, and reducing of waste. We're currently supporting projects to also within Australia and New Zealand to reduce waste that drives up a huge carbon footprint of medical care. Some of these initiatives include reducing the use of non-sterile gloves for non-invasive contact, reducing the number of unnecessary tests, which is a lot harder than it looks, reducing the number of IVs being placed in ED, which I think is a really great initiative. At the moment, pretty much everyone that comes to the door will almost everybody that comes to the door will get an IV cannula put in, and most of which are not even used. So how we can make a difference there. We're also looking at reducing or ceasing the use of nitrous oxide. That particular gas makes a lot of carbon dioxide when it's produced. So reducing that would be very, very useful. We're very much supporting and looking after our emergency departments to pursue this, noting that there are some things that are outside of our control, of course, but there are things that we can do, and it's up to each and every one of us to take it upon ourselves to do what we can to reduce waste wherever we see it. The other important part of this is really what Carolyn Hullick said, and that is reducing unnecessary tests is actually good care and good for patients, as well as being good for the environment. So it's ethically the right thing to do. So thank you for your time tonight, and thank you for the opportunity to speak.
Wonderful. Thank you very much, Stephen, and for all your work, and for ASIM as well for leading the way. Next, we have Dr. Austin Anderson from Australasian College of Dermatologists. Thank you.
Thank you. Kaya or hello from Wajak Noongar Budja here in Perth. Kate, I'll just get you to pop up my slides if you can. Thank you. I'm going to start with a 30-second overview of what's been happening in dermatology from an environmental point of view over the last year. So Kate, if you can just click through once. So this year, the World Health Organization has declared skin diseases as a global public health priority. And this is because many skin diseases go under-recognised and under-treated. We know that dermatologic disease is associated with significant stigma and discrimination. And the prevalence of emerging infectious diseases are increasingly reflected through skin manifestations. And as we all know, emerging infectious diseases are closely related with climate change. If you can click through, Kate. This is also reflected in our literature with concerns regarding multi-drug resistant fungal infections. And another click, please, Kate. And we're also beginning to understand the impact of climate and also environmental pollution on dermatologic diseases more clearly. Atopic dermatitis is probably the best documented at this point in time. Next slide, please. Another area that we're looking at in our environment and sustainability group is the use of plastics within the personal care products that we prescribe as dermatologists. So the UN has identified these key priority use sectors for reducing plastic use. One of these is personal care products. So this is the moisturizers and body washes that we all use. Most of these have intentionally added microplastics or synthetic polymers that act like plastics in our environment. And so we're investigating this in our college group. And just to note, also medical devices are one of these priority use sectors for us to target in reducing plastic waste. Next slide, please, Kate. So just to go through what we've done this year, we've had a plenary session at our annual scientific meeting, further exploring this issue of plastics and the impact on health and the environment. We have a sustainability network, which is hosted by our college's website, where we share information amongst fellows. This year, we awarded for the first time our Green Impact Award, which is awarded to a New Zealand fellow, Dr. William Hunt, for establishing an international dermatology sustainability network. And we're continuing to work on integration of environmental sustainability into our registrar curriculum and assessment as well. We are also very pleased to have ongoing involvement in the Climate Change and Health Multi-College Advisory Committee. Next slide, please. For next year, we have some exciting plans. We're going to expand on our registrar teaching through our National Skin School, both teaching our registrars about the importance of practicing dermatology in a sustainable manner, but also understanding the impacts that climate change and the environment have on skin health and disease. We are currently organising our sustainability symposium to be held at our annual scientific meeting next year. We will further dive into plastics and personal care products. We'll have a climate science update and then also discuss the challenges that I think we all face in implementing environmental sustainability actions within our day-to-day work. It's time for a review of our college sustainability policy, which was written in 2021 and needs to be updated to reflect the increasing maturity of our organisation. And we are also going to develop an Australian Sustainable Dermatologic Surgery guideline to reduce the use of unnecessary single-use products where they don't need to be used. And that's it. Thank you.
Wonderful. Thank you very much, Austin. It's great to hear what the dermatologists are doing and that you're really looking into the microplastics and plastics as well. So, yeah, that's very encouraging. Next, we have Jodie Long, who's the CEO of the Council of the Presidents of the Medical Colleges. Hello, Jodie. Welcome.
Hello. Let me just get my... Okay. Perfect. Great. Thank you. And thank you.
Sorry to interrupt. Would you like to put it onto presenter mode? Perhaps down the bottom screen.
Slide control show webinar.
Well, we can see your first slide, so it's fine with that.
Come up with the notes on the side, I guess. So
okay, that's okay.
Swap presenter view and slideshow. There we go. How's that? Is that better?
That's great. Thank you.
All right. Terrific. First of all, thank you very much for the invite. I really appreciate the invite to this really important topic. So really, I'm going to give more of a high-level overview just with regards to the colleges. Obviously, the colleges, the individual colleges tonight will be talking about the amazing work that they're already undertaking in their own individual college, and also obviously the important work that's being undertaken with the working group and the framework. So I really just wanted to highlight, I guess, the role that colleges play, and as the Council of Presidents of Medical Colleges, we represent all, 16 of the medical colleges. So they do have, we recognise they have an important role, obviously, with the training of our future doctors and training them to deliver sustainable medical care in a changing climate. They also have significant roles in research and obviously public leadership with regards to that climate action and promote and protect human health and well-being. So colleges do play a significant role in the future of healthcare and climate change. Carolyn already touched on the joint statement. It's a really important statement that was released last October, and joint collaboration across a number of organisations, including CPMC. And there was a commitment made, by all colleges, particularly around obviously developing low emission models of care, mobilising and supporting the health workforce, and making sure that we've got a very low carbon footprint as well. But part of that has to be then obviously turning that commitment into action. And as I mentioned, there is the working group that's doing fantastic work, and each individual college is doing amazing work in this space as well. But I guess our opportunity at CPMC is to provide the opportunity for colleges to share their best practice, to share the information across colleges, and really to encourage each other to lead in this space and to make the changes, particularly around, I guess, two areas. One is more on that training and standards with regards to embedding climate health and sustainability into the specialist training, and also on CPD, and really embedding that value-based models of care and low emission care. And the second part is making sure that the colleges really look at their own footprint, and they look at the measures internally on how they can reduce their carbon footprint themselves. look at the way that they procure, look at the way that they do events, travel policies, and obviously looking at fossil fuels with regards to their investment policies as well. And so really at CPMC, our role is to make sure that we keep that collaboration strong between the 16 colleges, that we're providing opportunities for the shared learning amongst the colleges in this area, that there's joint representation from us and really a unified message with regards to climate change and healthcare. And we really want to make sure that those climate health commitments that were made last October, that we really encourage that embedding in how the colleges operate, how they accredit, how they train, and how they support the specialist workforce. And especially in rural, regional and Indigenous communities, and that we really support them as well. So thank you for tonight, and thank you for the great work not only the AMA and DEA do, but obviously all the colleges as well.
Great, thank you. Thank you very much, Jodie, and to the Council for Presidents of Medical Colleges for really helping to collaborate with all the colleges and the leadership in this area. Next, we have Dr. Michael Rait, who's from the Royal Australian College of General Practitioners. To hand over, there we go, to Michael. Are you right to go, Michael?
Yeah, I thought we were going alphabetically, so I was sort of, I am. No, I am. I've got, give me 5 seconds. I'm just trying to, and
Or are you right, or would you like us to go on to come back to you?
I think I'm right. Sorry about that.
That's okay.
Can
Great. I
you...
don't know if you want to turn your camera on, but
Okay. Sorry. No. Okay, there we go. Sorry. Can you see? Oh,
there we go. That looks
okay.
great.
Sorry about that. Could you? Sorry, I'm not sure. I didn't go full screen. Hi, everyone. Look, thanks for the opportunity to speak with you. I'm Michael Rait, GP in Sydney. And I think, there we go. We'll even put the camera on. There we go. Nope. Seamless. There we go. So, look, I'd like to acknowledge that I'm on the land of the Gadigal people of the Eora Nation and pay my respects to elders past, present and emerging. RACGP, over 50,000 GPs and junior doctors, registrars training to be general practice. And we do support our members all around the country. Our core commitment is to support GPs all across Australia to address the primary health needs of all Australians, and increasingly we're advocating that general practice is the most effective part of the health system, the most efficient part of the health system. It's good for economic productivity, and it's also good for the environment, as Carolyn's alluded to, by providing prevention. We're actually keeping people well in the community and reducing greenhouse emissions and reducing the load on the health system by keeping people away from hospital. I'm just going to run through a couple of the priorities that the college has. The college, we are really proud to be a leader in climate change. We have a climate and environmental medicine specific interest group, which has been here for over 10 years, and a number of the members here are here tonight. I saw you before, Kate Wiley, so thank you for being here. The college has produced a number of environmental sustainability posters, which practices are encouraged to, GPs are encouraged to put in their waiting rooms. So if you scan that QR code there, I'm just going to cover a couple of things that we've been doing around trying to address impacts of climate change, around advocacy, education, a bit of internal sustainability work and resilience. The college produces the standards for general practice, which over 7,000 general practices are accredited to. And within the standards, there are criteria around implementing environmentally sustainable measures, fostering a workplace culture of sustainability, and also about trying to integrate sustainability principles into the daily operations and empowering staff through clear communication. The current standards are open for consultation has just finished on the 6th standards, and we look forward to sharing them later in the year. We've also developed a number of resources for practices, which they can look at how they can implement in their practice to safeguard public health, but also practical tools for reducing energy consumption, minimising waste, promoting environmentally aware practices. And recently we've developed an e-waste policy template to help practices articulate how they manage e-waste. In sustainability, we have a national conference next week, and we're having an interactive workshop on transitioning general practice to net zero. We also have an internal sustainability committee, and the main work of that in the last year has been, we've done greenhouse gas emissions assessments, trying to guide the college in its emissions reduction plan, and 100% of our electricity suppliers have now been transitioned to green power. I'm putting this in today because this was just released today. So it's a new resource for a new approved RAC GP resource about managing emergencies and disasters in general practice. There's a story about that on our website, which is called News GP. So if you go to the college website, and we've basically got 4 online modules that will help GPs and practices to understand what they can do to reduce the impact of disasters. In terms of education and training, so we do recognise that climate change disproportionately impacts Aboriginal and Torres Strait Islander communities due to the structural inequities from colonisation, and those negative health impacts continue. And we also recognise the leadership of our Aboriginal and Torres Strait Islander faculty in helping the work that the college leads in raising awareness about culturally safe care, as well as its impact on the climate. So we've got a nacho and RACGP guide on preventative health, which includes a dedicated chapter on the health impacts of climate change. In our conference next week, we're also including an Indigenous-led panel discussion specifically about the impacts of climate change on Aboriginal and Torres Strait Islander people. And then next year, we've got an update of our curriculum, which is going to expand planetary health context with a standalone unit on climate and environmental medicine.
30 seconds, Michael.
Thanks. We put out a journal which often has issues around. The September one was around preparing for extreme weather webinar, and we had a special edition this year about disaster management in February of our national journal. That some of the other favourite people. So this was at Wonka in 2023. So prior to the election, we joined with DEA, calling for strong climate action. We are a member of CHIAG, as well as being on the Multi-College Advisory Committee. And even more recently, we're submitting the regulation changes in the City of Sydney, banning inclusion of gas appliances. So we are sort of advocating at a community level, and I will hold it there, I think.
Great. Thank you very much, Michael. I turned my video off because I was being double videoed there. Yes, and really for highlighting and reminding us the importance of GPs in preventative and primary care when it comes to sustainability and climate change action. So yes, great to see what the College of GPs is doing.
Thank you.
Next we have Dr. Lauren Kite from the Royal Australian and New Zealand College of Obstetricians and Gynecologists. Lauren.
Just bring my screen up. Is that
Yes,
working properly?
that's great. Thank you.
Great. Okay. So thanks very much for having me along. I'm representing RANZCOG. Just flick to our next slide. So in the spirit of reconciliation, RANZCOG acknowledges and pays respect to the traditional custodians of the lands, waters and communities across Australia on which our members live and work, and their elders past, present and emerging. And I'll just acknowledge that I'm on Yawuru country today. RANZCOG also recognises the special status of Maori as Tangata Whenua in Aotearoa, New Zealand, and is committed to meeting its obligations as Te Tiriti o Waitangi partners. So RANZCOG this year, or towards the end of last year, formed an environmental sustainability working group. And just in the last month, it's been established as a committee. So should continue going forward. The things that we've been doing, we've just updated our statement on climate change. We have an ONG magazine that comes out quarterly, and we've been working towards, and we'll continue to work towards having a sustainability article in every edition. The last couple have had articles on healthy investing, and one recently on decommissioning pipe nitrous in a maternity hospital, which we believe might be the first maternity unit in Australia to do so. We are changing to sustainable office waste management and partnering practices within our head offices, and continuing to participate in the multi-health college working groups that have already been mentioned. So in development, within our newly formed committee, we are working on an ONG sustainability audit tool for clinical practice that should attract CPD points. We also are developing specific resources to support ONG clinicians and patients on sustainable care and impacts of climate and environment on pregnancy and women's health. Within college governance and operations, we are just hopefully very soon launching a dedicated web page on our website on environmental sustainability. We are finalising an environmental sustainability policy and investigating carbon neutral pathways. And coming soon in 2026, AFOG, which is Australasia Oceania ONG group, will be in Sydney. RANZCOG is hosting, and the focus of the meeting is sustainability. Thank you.
Great. Thank you very much, Lauren, and thank you for that update. Good to see what the obstetrician gynecologists are doing in this space, and we look forward to hearing particularly more about nitrous actually going down the track. All right, great. Next, we've got Dr. Angelo Vagona, who's from the Royal Australian New Zealand College of Psychiatrists. Thank you, Angelo.
Thanks, Eugenie. Thanks, Kate, for the slides. So I'm representing the college tonight. Our president, Asta Tomar, was unable to attend, so I'm really grateful to her because I've learnt an enormous amount tonight, and I'm really grateful to the DEA and AMA for inviting us and for the opportunity to see what everybody else is doing, which has got my collaborative and competitive juices flowing. I'm on Dharawal country, and I want to pay respects to the traditional owners, and my apologies to them for desecrating their lands over the last 50 years with internal combustion engines, and I'm moving toward a ute, which is a hybrid, so I'm getting there. If we can move on. Thanks, Kate. I'm not going to spend too much time talking about the impacts of climate change on mental health. I think everybody is sort of aware, and it was referred to earlier by Nick and Julien. But, you know, we see increase in ED presentations with the hotter weather of people with mental health conditions. And data's coming out telling us that 1.8% of the total mental health burden is attributable, you know, just to extreme heat. And so this is only going to get worse. Thank you. And of course, we've seen with our own data in New South Wales that with mean temperature rises, we're getting increased presentations in the youth cohort with suicidal ideation. Next, thanks. We're also seeing increased rates of disorders linked to the extreme weather events and natural disasters. So all those disorders that you see there, all increased rates occurring as a result, and they're all sort of significant and trauma related. And these are having significant impacts, particularly we see it with our patients also with severe and chronic mental illness, who are the most disadvantaged, living in the most marginal circumstances and much more vulnerable. They have a much higher risk of hospitalisation and death during extreme heat. Next one. So you've seen the National Climate Risk Assessment has been mentioned in detail, and of course health and social support is going to be severely impacted, and particularly mental health within that area. We've been engaged with the DEA. We had our New South Wales branch chair, Pramudi Gunaratne, along with Sibel Day, who's a psychiatrist from Sydney and is very active as the chair of the DEA Mental Health Advisory Group in Canberra last week, presenting a DEA report on the impacts of climate change on mental health that was well received. Next one, thanks. And so the college has been doing a fair bit over the last few years. You know, probably the last 5 years we've become more active in this space. We've had a position statement since 2021. We've got some pretty active researchers and academics who are publishing more on the impacts of climate change on severe mental illness, and as I mentioned, the particular risks to them. The college has divested itself of the investments in fossil fuels since about 2021, and we've been working collaboratively with other medical colleagues, submissions informing the development of the National Health and Climate Strategy, the Healthy Climate Future Campaign, and the 2024 Joint Statement that's been referred to tonight. Next one, thanks, Kate. We had a group that started in New South Wales when I was the chair in New South Wales. Everything that good happens in our college comes from New South Wales. I'll just sort of put a plug in there. And so with due to Sibel Day's advocacy, we developed an interest group in New South Wales, which became more of a binational interest group. And this year has led to the formation of a Planetary Health Advisory Group in the college. And the group is planning to provide a community of practice for members and provide guidance and expertise on college work related to climate sustainability and mental health. There was a webinar this year that we did on heat and mental health in collaboration with DER, and there's the QR code if you'd like to have a look. And there's been other previous webinars that are available on our website if people would like to have a look. Next, thanks, Kate. In terms of the future focus, really raising awareness, supporting change through conference presentations, webinars on planetary health and mental health during 2026. There's a fair bit of activity in that space. Compiling an online list of free resources, continued collaboration with everybody here tonight and other stakeholders, and we're scoping the development of e-learning modules specifically for psychiatrists and psychiatric trainees. Next, well, that might be it. Anything else, Kate? No, that's it. So thanks very much, everyone. It's been wonderful to hear what's happening in this space across the board, and it's really given us some really good ideas to take forward. Thank you.
Well, thank you, Angelo. And it's really so important that the psychiatrists are really coming on board and lending their expertise and weight when it comes to mental health impacts and climate change and heat. So great to see. Next, we have Dr. Archie Srivathas, who's the representing the Australian New Zealand College of Anaesthetists. Thank you, Archie.
Thanks, Eugenie. And thank you to everyone who's here today and for inviting us to contribute to this extremely valuable webinar. Firstly, I also acknowledge that we are a binational college, and so I'd like to acknowledge the traditional custodians of the land that we're meeting on today. For me, that's the Whadjuk Noongar people. I'm from Perth, and I would also like to pay my respects to ancestors and elders past, present and emerging. As a binational college, obviously, we also respect Ngāiwi Māori as the tangata whenua of Aotearoa, and the ANZCA is committed to upholding the principles of the Treaty of Waitangi, fostering the college's relationship with Māori, supporting Māori fellows and trainees, and striving to improve the health of Māori and Pacifica peoples. I'm presenting today as the chair of the ANZCA Environmental Sustainability Network executive. Unfortunately, our president, Dr. David Story, Professor David Story, could not be here with us today. Just a little bit of background into what's gone into the college's approach to sustainability. The ANZCA Council made a statement on climate change in 2018. And since then, a number of further actions have taken place, mainly driven by the Environmental Sustainability Working Group, which has since evolved into the network. We currently have the Sustainability PS64, the professional statement, which outlines the expectations of college fellows and also of the college itself, an audit tool to guide quality improvement projects and initiatives, and also a library guide to which we add quite regularly healthcare and anaesthesia resources. From a college perspective and endorsements wise, we are also signatory to the Joint Statement on Climate and Health, where members of the Health College Working Group on Climate Change and the Multi-College Advisory Committee, and recently also endorsed the Green College Guidelines. We have three major goals as the Environmental Sustainability Network, both to promote sustainability and also to engage with college leadership in order to raise this as a core business item within the college. So that includes advocacy, education, and research and quality improvement at all levels. I've outlined them here briefly. I won't go into them in a huge amount of detail because we have made some progress in the last year, which I'd like to talk about a little bit more. Firstly, from the executive perspective, we now have members representative of almost every Australian state, as well as New Zealand, and also our trainees who have been pretty elementary in contributing to the sustainability work within the college. We report directly to the Professional Affairs Executive and also to the Council directly. And also have both hybrid meetings and strategic planning sessions in order to plan our activities. There's a number of portfolios within the Sustainability Network and representation, as I discussed earlier. In terms of advocacy, probably the key things that we've achieved in the last year has been the release of the ANZCA statement on desflurane. Desflurane, for those who may not know, is an environmentally polluting anaesthetic gas, which is slowly being phased out globally. This has been endorsed both by ANZCA and other organisations around the world. But importantly, within Australia, we've also contributed to the ATACH, so the Council of Australian Therapeutic Advisory Groups statement on the formulary listing of desflurane and how it should be at least considered to be removed due to its environmental implications. As mentioned by a couple of other speakers, nitrous oxide has been a really big topic in the last year, and we have a specific mitigation working group within the Sustainability Network. Nitrous is an environmentally contaminating greenhouse gas, and it leaks from the pipelines in which it is transported to patients, which means that a lot of nitrous that is purchased doesn't actually make it to patients, it pollutes the environment instead. So there's a global move again to decommission pipeline delivery of nitrous to patients, and rather to move towards either cylinder delivery or to a general clinical reduction in use. We recognise, obviously, that isn't always possible in some areas. However, we have worked in a number of ways towards changing both policy and guidance, and also supporting clinicians in move towards using less nitrous and to decommissioning existing manifolds. We're currently in the process of reviewing the PS64, which is the Professional Statement on Environmental Sustainability, which has been a pretty significant undertaking, and also infection control guidance within the college, which I'm sure any of you who've been involved in sustainability will know is a pretty significant aspect of introducing new reusable and also sustainability concepts within certain areas, particularly in the operating theatre space.
30 seconds, Archie.
Thank you. We've also been collaborating across other colleges and organisations such as RACS. We've had involvement, very significant involvement in our ASM in the last year, and a number of webinars which are available through the Environmental Sustainability Library Guide. A research and QI section, which we are also upskilling and upscaling at the moment, including collaboration with international research projects. And quite a few future plans, which include both internal and external collaborations, importantly including CPD program integration into ANZCA, and also development of a greener anaesthesia guide for Australia and hopefully New Zealand, although we recognise that's quite different policy framework and environment at the moment. Just briefly, I'll leave on the greening of ANZCA's operations, which is also being guided by the Greening College Guidelines and also by the Sustainability statement as well. I'm happy to take any questions. Thank you very much.
Wonderful. Thank you, Archie. And personally, as an anaesthetist, I'd like to thank you for your leadership in this area, because you're really driving so much of this at ANZCA. So it's great to see. We probably won't have time for questions at the end. We'll see how we go. We've still got another 4 presentations, but we're going quite well here. So next we have Associate Professor Terry Slevin from the Public Health Association of Australia.
Thanks,
Welcome.
Eugenie. Angela, good luck being re-elected with your crack about New South Wales, by the way. Just going to the presentation. Let me see, there it is. We'll share that and just confirming people can see that. Yep, okay. We're a small organisation with 2,000 members and Public Health Association's been going for now more than 55 years. We focus on policy and advocacy across a range of public health issues. The environmental and ecological work is very much central to our purpose. But before I go any further, I acknowledge traditional owners of the land where we meet. I'm on Ngunnawal Ngambri people here in the nation's capital. A range of organised activities. The long-standing special interest group has been very much driving our policy development. So like many of you, a whole range of policies in this sphere, climate and health, mental health and climate change, very much engaged in the One Health sphere as well. We're very much involved in promoting public health policy and practice. We have branches across the country for every election that's held, state and territory and national. We set out a series of policy asks. Climate and health action is always a part of those, and we rate all political parties in their responses to our asks pre-election, so as to give guidance to people with regard to those political parties who are taking action in this sphere. In terms of our external activities, we work in partnership with a whole range of you, a number of your colleges, be it AMA, DEA, many others. It's very much a central part of what we do. We've been very much involved in pushing for the establishment of the Australian Centre for Disease Control. We're involved in the establishment of the Climate and Health Alliance, and we make contributions as members to various entities. Our former president, Tarawera Manthri, led the Climate and Health Review in Western Australia, which was important and influential. Paul Kelly, another member of ours, former Chief Medical Officer, is wearing a PHA hat in the Climate and Health Alliance Board, and we contribute to government inquiries with regard to environmental and climate issues on an ongoing basis. So submission to government inquiries, appearing in hearings and the like, and presenting evidence-based guidance with regard to climate and health policy is an ongoing part of our core work. Contributing to the climate and health strategy. Those of you following the news will know that the Senate today passed the legislation to establish the Australian Centre for Disease Control. The final legislation will go into the House tomorrow. We pushed for an amendment into that legislation that required the CDC to include in its annual reporting with regard to both pandemic preparedness and climate and health action. So that will now become a routine part of the annual report presented in Parliament of the actions of the Australian Centre for Disease Control. CDC is something we've been batting for since 1987. It's a long way to the shop if you want a CDC. The other activities, and by the nature of being in Canberra, we do turn out to Parliament House on a regular basis. We joined Kate and friends in Parliament House in the lead up to the May election this year to debate the issue in relation to nuclear energy as a viable energy source within Australia. Having very friendly conversations with our friends from National and Liberal Party with regard to that policy issue. We know with the way the election fell, worked at state and territory level with regard to the gas expansion of the Northern Territory, and yesterday presenting with our friends at the Australian Council of Trade Unions with regard to the climate change and impact on workers. Fascinatingly, they pointed to the fact that the Work Health and Safety Ministers Council around Australia from states and territories have never considered the issue of the impact on climate on workers. And so part of the effort of trawling around Parliament House, and I attended the meeting with Chris Bowen at the media conference and the briefing yesterday morning at 7:30, where there was a pretty decent turnout of members, I was surprised to report we talked about many of the things that you've discussed today: focus of mental health, the impact of climate change, the impact of heat, the impact of increased infectious diseases associated with climate change, and so on.
Getting to time now, Terry. Sorry.
Okay. And so we'll continue to work in that space. We run conferences, and climate and health is an ongoing feature of our annual conference. So we are enthusiastic and continue to work with you and the policies that you're putting in place. I'll shut up now.
Good. Thank you very much, Terry. It's really good to see and to be updated on what the PHAA is doing. So thank you. We have 3 important presentations still to go. So hold with us, everyone who's on board. Next is Professor Jennifer Martin from the Royal Australian College of Physicians. Jennifer. Are you on still, Jennifer? You are. Somewhere? There we go.
Popping in and out. Yeah, thanks, Eugenie. Kia ora. Hi, everyone. Thanks very much. I've heard many of the presentations today, and it's fabulous to hear medical colleagues discuss this issue and to work together on something that's an existential threat to us all. So I've only got 5 minutes. I think I've got 4 slides there. Are you able to put those slides up? Essentially just summarising what we're doing, really just to share our work in policy and advocacy, our events, education, professional development, really highlight our focus in the college on health, but also our fossil fuels work, which is a work in progress, but hopefully 2026, and really just signal our real interest in collaborating to multi-college sharing and collaboration on climate change and health, as well as sharing with government bodies and the Commission and a variety of other groups that are leading this, certainly from a health perspective. Just thanks to you, Kate and team. Nick's not here, but I wanted to thank him too. I heard his introductory pre-record, but to thank DEA and the AMA also for the opportunity to share our work today and for bringing us all together. I am speaking from unceded Awabakal land and do extend my respect to all Aboriginal, Torres Strait Islander and Maori people and value the importance of their ongoing connection to land, sea, sky and community. I pay my respects to elders past and present. Indigenous health and equity are also central to the work we do in the college, and that's become an increasing focus for us in the college and the work that we're doing around climate change and health. If I can just focus on policy and advocacy, because that's the part of the college where we lead most of this work. And I would just like to thank at this point the incredible leadership of our CPAC team by Dr. Anna-Greta Hunter from Canberra and also Christian Gericke. Anna-Greta is now the chair of the ACT Climate Change Council, and just want to thank her leadership and support on the college policy and advocacy group. As you know, we've got a few governance issues in our organisation at the moment. So unfortunately, CPAC is not working at the moment, but we're hoping that once we tidy up some of the other existential threats to our organisation, that we can get back and start working through our policy and advocacy team. But this is a priority area for us, and it's led by member experts across a wide range of specialties. And I think it's really important just to acknowledge that as well as public health, we actually have a lot of adult medicine physicians and paediatricians who see the effects of climate change in their population groups and the outcomes also of in terms of perinatal health for pregnant mums. So it's really quite an all-encompassing area, I think, for members in our college. Earlier this year, we did actually host an event for visiting health officials and academics from Singapore. I think, I'm not sure if we're on the right, it might be the slide before that, but that's okay. So that was great to meet people from Singapore, actually, and to see health leaders, physicians, and I've caught up with some of those physicians subsequently, another trip to Singapore, but really just to learn from our colleagues there how they actually did it. I think it's one thing to sort of know that we have a problem and to know the links with health outcomes, but how you're actually effective in implementing change, which you really need everybody on board to be able to be effective in that role. And I think we've certainly started to think, you know, how can we actually be effective rather than just talking about all the data that we've got? Obviously, there's a different culture in Singapore, but certainly they, through good leadership, have been able to implement through their healthcare systems a lot of things that we'd like to do. Reducing low value care was a common theme, and that was really helpful to hear how they've reduced pathology testing, the use of medications, my area, that don't work or that are wasteful. And at the college, we're really driving that part of the climate change agenda through our Evolve program. Haven't really got much time to talk about that, but I'm happy to talk to anyone about that later, because that connection between Evolve and our climate change and health and environmental sustainability work is becoming even stronger, and we're really trying to make those connections between Evolve and the environmental sustainability to actually ensure that we can implement some of our knowledge about what's happening in the healthcare space. So our flagship Evolve program does support high quality evidence-based care, seeking to reduce low value practices and promoting clinical decisions that improve patient outcomes. So we've got our top 5 lists through Evolve, which is all of our subspecialty groups in the college who basically have 5 action lists of how they're going to reduce low value care, and certainly there's climate impacts on that. And just lastly on that, we've tried to focus on embedding climate change into our election statements, and we had a 2025 pre-budget statement, the federal election statement and our WA election statement, and we were, I think, quite a bit more bold on our asks than we had been before. We did actually, in the federal election, release a joint statement with 8 other colleges. So thanks for that, colleagues.
I'll have to ask you to wrap up pretty soon, please.
Yep, and so that joint statement, I think, is really worth looking at if you haven't seen that. And just to the last point, actually, we've seen the MJ Lancet countdown work on the slide, but we're really advancing this work on policy impacts of fossil fuel use in health. It's a real focus for us, and we're certainly building position statement on health and fossil fuel statement, which will be released in 2026. So we hope to launch that in April next year, so look out for that. Yeah, really enjoy working with you all, and thank you so much for your leadership to the DEA and AMA, and for the invitation to speak today. Thank you.
Thank you. Thank you very much, Jennifer, and thank you very much to RACP for actually their leadership in this area for well over a decade. Next up, we have Dr. Andrew Wines from the Australian Orthopaedic Association. Hello, Andrew.
Thanks very much, Eugenie. Kate, I'll just get you to throw up the slides, please. Thank you. So I'm Andrew Wines. I'm an orthopaedic surgeon in Sydney, and I'm the first Vice President of the Australian Orthopaedic Association. I very much feel like a minnow in the company of giants. I'm very grateful that the Australian Orthopaedic Association has been invited, but I congratulate the work of everyone and all the other associations. It's been tremendous to hear. Next slide, thanks. I'd also like to thank Sibel Day because she helped me prepare these slides. And I thought what was very interesting is having a look at the carbon footprint of orthopedic surgery. Simple operation like an arthroscopy generates the equivalent of 400 kilometres in one of those old-fashioned non-electric cars. And if you look at a joint replacement, generates somewhere around the equivalent of 85 kilograms of CO2. And in Australia last year, there were 60,000 or thereabouts hip replacements and 80,000 knee replacements. So you can see that's a lot of long journeys in old-fashioned cars, the equivalent of what orthopaedic surgeons do each day. And then when you look at more complicated and longer procedures such as revision joint replacements, you can see that the carbon output there is not insignificant by any stretch of the imagination. Next slide. And looking at what contributes to that huge carbon footprint from orthopaedic surgery, the main offenders are the supply chain, the temperature control and laminar flow, and the importance of sterility in the operating theatre, sterilisation, other uses of electricity and waste disposal, and the anaesthetic itself contributes only 4%. So unfortunately, we're not able to blame our anaesthetists. Next slide, thanks. So the AOA has made a very reasonable effort, I think, in trying to embrace the Green College guidelines. We've embedded in our strategic plan, and you can see here the breakdown of areas of the Green College guidelines that we've been able to incorporate and others that we're still working on. Next slide, please. The role of our association has been very much in raising awareness with our members. It's been encouraging best practice and highlighting the value of things like telehealth, virtual meetings and conferences, and establishing any energy efficient procedures in operating theatres and surgical techniques. We have a very close association with hospital and industry, and by collaborating with those groups, we're hopefully able to decrease our carbon impact. We've recently joined the Qantas Business Carbon Program, so that's hopefully going to decrease our carbon footprint with regards local and international travel. And we've made a big effort at our congresses and annual scientific meetings to have very limited use of plastic name tags, plastic bags. We only ever use recycled paper, and we never print any programs. Next slide, please. So in 2002, we had a combined meeting, as we do every 5 years, with the Kiwis. And sustainability, as you can see, was one of the key themes, along with togetherness and diversity. And you can see on the slide on the right-hand side, our president, Annette Julien, opening that session that was in Christchurch. And next slide. And this is just a couple of examples of the talks that we had during the plenary session on sustainability and in particular our role in reducing the carbon footprint. You can see Craig Bussell there, who is best known for his Chasers War on Waste, giving us information on sustainable hospitals and things that orthopaedic surgeons can do to improve our ways. And Rait Oram, who's a Kiwi, discussing restoring our right relationship with the living earth. So it's something that's front and centre at the Australian Orthopaedic Association. And again, many thanks for having me here tonight.
Thank you, Andrew. And it's great to see that the orthopaedic surgeons are becoming engaged in this area. Very encouraging for us all. Next up and final but not least, we have Dr. Peter Kruger from the College of Intensive Care Medicine. Thank you for being so patient, Peter, and welcome.
Thank you very much. And I don't have any slides to talk to, but it's an absolute privilege to have been listening to the others present and to be here on behalf of our college. And it's interesting, there are many shared topics we've listened to that are of relevance to our college, and we share some of the initiatives. Just to run through some of the things, we continue to endorse and promulgate various other works, and the joint statement Jen mentioned leading up to the election was something our college considered and was part of. We have an environmental sustainability special interest group that was in 2022, and I thank Forbes McGahn from Australia and Louise Trent from New Zealand who co-chair that. And we are actually looking at reinvigorating that group. And we recognise that intensive care medicine, like many other subspecialties in medicine, is a heavy resource intensive area, and so that gives us immense opportunity to make a difference. We also recognise that the multidisciplinary team in the intensive care is an important component of that, and so we're going to partner with some of the nursing and allied health organisations, because the boots on the ground where we can make a difference in the ICU often involve other groups, not just the medical profession. And so we're looking at a sustainability collaborative with those other organisations who work in the intensive care, because that's where many of those members are looking to make initiatives in their own intensive care units. We're also looking at research into sustainability, and Forbes McGahn's been a champion in this area, trying to educate trainees and fellows to take those opportunities to look at research. People have mentioned nitrous oxide, and we too have been looking at the use of nitrous oxide. Somewhat to our surprise, there are several new build intensive cares that are piping nitrous oxide never to be used into their buildings, and so our guidelines on building new ICUs are going to have some strong commentary around that maybe isn't required in an intensive care. And then we have some education focus. Our annual scientific meeting this year, Forbes presented a fantastic session on looking at sustainability research, and we had a lot of practical initiatives at the meeting about, like others have mentioned, no printed material, try to reduce waste, sustainable travel, selecting suppliers based on some of their sustainability and climate credentials. And I guess finally, we've recently moved into a new building and are now, existing in that building where we had front and centre as we designed and commissioned it, some sustainability thoughts. And so seeing those come to fruition in the day-to-day activities of the college has been very rewarding. So they're just a snapshot of some of the initiatives from the College of Intensive Care. And I thank you again for allowing us to be part of this terrific initiative.
Great. Thank you very much, Peter. And for all the work that, yes, SICM has done and the intensive care, your intensive care colleagues around Australia and in New Zealand. It's actually 9 minutes to 9. So we've gone a bit over time and I think it's time to wrap things up. I'm sorry that we won't have time for questions like we did last year, but I'd like to really thank all our speakers and our panelists for really being fabulous at sticking to time and for joining us tonight, and all our participants as well. So many of you have stayed online to the very end, and I'm sorry that we can't open it up for a robust Q&A session. There's lots of take-home messages from what we've heard tonight, and the voice that we have and the importance that we show leadership and action when it comes to climate change and sustainability. I think, though, you'll probably all agree with me that it highlighted over and over again the importance of collaboration and how we've managed as a medical fraternity over the last few years to actually become quite good at that. We haven't always been that good at it over the years, whether it's the joint statement, this webinar, education. As Jodie Long said from the Council of Presidents of Medical Colleges, one voice is real impact, and that's really something that's good for us all to remember as we look at what we can do about this existential threat to health and all of us. It's a health issue. We have agency, and it's our business. It's our business to get our own house in order, and so encouraging to hear what is being done, but also, as was mentioned, to be bold and to be bold with our wider advocacy when it comes to action on climate change. There are a lot of fabulous resources on both the DEA and the AMA website, and I encourage you all to have a look at that. And we will eventually, I'm sure, get the recording up on the website. The recording of the other 4 webinars is there. So before I hand over to Julien, who might like to say a few final words, I'd also like to thank both those at DEA and also the AMA for coming on this journey with us over the last 5 years. It's been great.
And thank you to you, Jenny, for being such an excellent chair tonight. I think you kept us all to time, and it was really a terrific discussion. I think finally, if I could just make a few observations that, and apologies for being a little political, but I think Australia shouldn't be having debates around net zero and what it means in dollars and cents. And I think tonight we should be encouraged that we've had debates around best climate practice, and how we can mitigate the impacts on human health of climate change. We also need, I think, to ensure that Australia implements its national climate and health strategy. And I do look forward to our next webinar in 12 months' time, hosted by the AMA and the DEA, and hopefully we can celebrate the outcome of the implementation of that strategy. And I do look forward to further discussion with all the groups that are here tonight, and thank you all for your attention.
Great, thank you, and good night all.